Peace and blessings, YouTube family, and welcome to Passing the MRCPCH Clinicals. Alright, so today we're going to do a very quick introduction video to the clinicals, and I'm going to give you my top 10 tips on how to pass the MRCPCH clinicals the first time, just like me. So tip number 1 is pick the right textbook. So don't worry too much about the theory, because that is stuff that we'll be talking more about on my theory examination series. But the important thing is that the clinical examination textbook that you have should tell you the sequence of examination, should tell you which clinical sign to take or to elicit, and should teach you what the clinical sign should look like. All right? And that leads me on to tip number 2, which is that I have prepared a free, completely free MRCPCH clinical examination guide, which you can access via the link in the description. It's completely free. The only thing that I ask for is once you've used the guide, please send me some feedback on the guide so that we can improve it for future generations, so you can help the future cohorts that go for the examination. Tip number 3 is always try and get a group that you can practice with, because you'll be able to test a lot of your own knowledge with the group, and also you'll learn a lot from the group. Passing rate increases exponentially if you have a group that you can practice with. Get a group, maybe about 3 to 4 people, and practice. Leading on to tip number 4, which is how often should you practice? So personally, what worked for me and a lot of other people was practicing regularly in about the 3 months before the examination, practicing about 30 minutes a day, choose one station, one skill, and then focus on that. Next tip is we need to focus on clinical signs only. When you go into your hospital, focus on clinical signs only. And my tip for being the most efficient with your examination technique is practice your examination technique at home. When you're at the hospital looking for patients with clinical signs, find out what the clinical signs are and just go and elicit those signs only. You don't need to do a top-to-toe examination of the neurological system if the child has just got ankle clonus. Focus on the ankle clonus. Make sure you can elicit that sign and you can recognize that sign. Yeah? Because the exam is mainly about pattern recognition and then interpretation. Next tip is YouTube videos. All right? YouTube videos are the most helpful thing when it comes to clinical signs and understanding clinical signs. So my recommendation would be is to go through the clinical signs that you have not been able to see or elicit. And in my free guide, I have specified most of the presentations and the cases that will come to the examination station. Go through them and look at the clinical signs. Make sure you can identify them. The more confident you are, the more confident the patient and the examiner will be with your technique, and the more likely you are to pass the exam. So those tips were how do you prepare before the day. Now going on to what you should do on the day of the examination. So ideally, book a hotel for the night before in the city that the examination is going to be in, so that you are relaxed and you have a calm mindset as much as you are able to do. And make sure that you look on maps and ideally try and get to the hospital the day before so that you know how to get to the hospital, where the hospital is, where the location is. All of these small things will help you feel a bit more relaxed about your environment and will help you to do better in the examination. Next tip is have a light breakfast. I can't tell you so many people who come to me and have said that I felt really unwell on the day because I had a big breakfast and I went in and I just felt really nauseous because of my nerves. I just felt really, really ill. So do yourself a favour, have a light breakfast and pack some snacks with you. And final tip on the day, breathe. Before every single station, take 3 deep breaths in, activating your baroreceptors, dropping your blood pressure, helping you to relax. And also on the day, every station that you have is a separate station. When you've finished your station, again, take 3 deep breaths, and that will help you to forget about the station that you've just had, how well it went. Maybe it didn't go so well, but if you prepared well, then there's no reason that the stations should not go great. And finally, one of the most important tips, plan something to de-stress yourself after the exam is done. Have a treat in mind, or a restaurant that you want to go to, or an experience that you want to do. And all of these things are going to make you feel like that reward at the end will be worth it. So just keep calm, keep practicing, and keep subscribing and waiting for the MRCPCH clinical series, where I'm going to talk about every single station, how you can pass that station, and some special tips and tricks on how to really impress the examiner. So please like, comment, subscribe and share for more videos, and send some love to the baby doctor. All right. Peace and blessings, YouTube family.